Hi everyone, welcome to researchmd.com. Today we're going to go back to the research world and take a look at an exciting development in the treatment of or prevention of diabetes. Okay, this drug called teplizumab was approved by FDA for the treatment, I would not say treatment, for the prevention of diabetes type 1. Okay, very, very exciting news indeed for a lot of people suffering from type 1 diabetes who are worried about what's going to happen in their future. They've been frequently checking their blood sugar like every day to see are they going to develop diabetes or not. Okay, so this drug, teplizumab, is actually produced by a New Jersey pharmaceutical company called Prevention Bio. It was approved on the November 17th by the FDA for the use in United States at this point. When we look at, I think it's important to understand the difference between type 1 and type 2 diabetes. Type 1 diabetes is more like a genetic, it's an autoimmune process, okay? So in the autoimmune process, what happened is the body recognizes its own cell and start attacking them. So, the insulin in the body, which controls the blood sugar, is produced by this islet cells of pancreas. So, what these autoantibodies do is they start attacking pancreatic beta cells and destroy them, so there won't be any insulin to control the blood sugar. So, what happens? So, blood sugar shoots up, all the complications develop. So, in type 1 diabetes, there's actually like 4 stages. Stage 1, what happens is like there's a trigger, okay, and then stage 2, all this autoimmune markers like islet cell antibody, they start producing, and then it take like around like 4 to 5 years, and then you go into stage 3. And what happened during the stage 3? Your blood sugar goes up, you start having symptoms, and then finally you go into stage 5, all your beta cells are gone. You're stuck with, you don't have any choice. You have to take insulin for sugar. So this company called Prevention Bio, they developed this monoclonal antibody. Okay, you heard about monoclonal antibody. It's actually come from the plasma cells and is targeted, specifically for that disease. Each disease they make monoclonal antibody, just only attack that organ. So no other damage to the other tissues. Very famously, like we use that in the COVID-19 treatment, and especially the lung cancer treatment has been amazing. So this is actually a monoclonal antibody, teplizumab. Okay, so how do we dose it? What are the indications? First, we need to know the person is in stage 2 type 1 diabetes. Okay, so how do you do that? You check some markers. There's some autoimmune markers like islet cell antibody. You have to have at least 2 of these autoimmune markers present, and then you can give this drug. How do you give this drug? This drug is given as an infusion, and it can take up to, you have to do 1, 2, 3 up to day 14. Gradually they increase the dose. Now you have to do blood count. You have to check your liver function test. Sometimes it can cause some of the blood count to go low. Liver function tests can go up, so that need to be marked. Again, this is an amazing drug. The company is Prevention Bio. If you look back their stock 6 months ago, their stock price was hanging around to $4. Now it's almost, I think it's went up to $9. So it's important to follow, some of those videos we produce, so you can also make some investment also. Again, this is very, very important, people for type 1 diabetes. This can delay the progression. The studies have known it can delay the progression. You can hold on, not going into the diabetes. Okay? Thank you so much for watching. We'll be back with another presentation soon. God bless.